Hello, I'm Michael Finn, holistic exercise and lifestyle coach. And today we are going to talk about pelvic posture, the whole posture of the pelvis. That is basically kind of like our whole hip structure and how it tips forwards and backwards. Primarily, that's what we're going to talk about, not so much about how when it tips side to side, but more front to back. Really important topic for posture. Typically, this gets messed up with a lot of sitting and particular muscles getting tight, and it will mess up with you creating power when you're running or you're walking or cycling, any kind of cyclical activity like that. If it's not in a good alignment, you're reducing your ability to produce power in that position. And also, it leads to a lot of aches and pains and wear downs and breakdowns in the body, in the feet, as in you can, have some sore feet or plantar fasciitis, things like that. The calves can have problems, same kind of thing with that whole plantar fasciitis, and or like say shin splints if you're a runner or a big walker or sprinter. It can lead to knee problems and the knee joints wearing out sooner than they really should. It can cause hip problems and the hip joints wearing out sooner than they should, requiring hip replacements later in life. And it can cause a lot of problems in the spine, whether it's a lack of function, a lack of motion, or a bunch of compression, and or just, you know, not straightening out the springs of the body. So our lower body needs to be springy so that when we're walking or running or jumping or going up and down stairs or what have you, the natural springs and dissipation of the loads of you landing on the ground should be dissipated through your feet, your knees, your hips, and your lumbar spine primarily, with the function of your lower abdominal muscles and your glutes and your low back muscles and the whole complex in one big unit. And if that's not, it can lead to a whipping effect up the spine into our neck and causing neck pain. That's why some people will get headaches when they walk for long periods of time or run for long periods of time, because that whip is coming all the way up in their skull, and their occipital muscles at the back of their neck are like having to try to stabilize what should be totally stabilized at the pelvis, but it's coming all the way up the spine and whipping their skull around and causing all sorts of pain. So, with all that fun stuff, let's take a little look here at good old pelvis posture. So this is what we call our Donald Duck posture. So I have a little Donald Duck over here. So, and this is where we are sticking our tailbone out and the front of our pelvis is tipped down. So this is an anterior pelvic tilt posture. So if you think of your pelvis as a bucket of water, so if you put your hands on your hips and you tip your hips forward, it would be like dumping water out of the front of the bucket. That's an anterior pelvic tilt. And what this ends up doing is, you can see here in my posture on the left here, my knees are straight, they're practically locked out. And that's because of that position of my pelvis. So because the hamstrings are attached onto the backside of the pelvis, it's straightening those legs out and straightening the knees out. And then it also shifts. You can see how all of my weight is now shifted more forward. So if you drew a line straight through my ankle and came up, the line's going to end up going behind my whole upper body. It goes through my hip, more of the backside of, about close to the middle of my hip. But then everything above my waist is like, it would be ahead of that line. Okay, if you can see my cursor here. So all of my weight is forward into the balls of my feet. It's not back here in the heels where it should be. And because of that, it puts tremendous amount of load down the front side of your legs and into your kneecaps or your patellas and the patella tendons. And so all of this causes tremendous amount of load. And so if you are like this, now this is an extreme posture. I'm, forcing myself into this. But there's a certain amount of degrees that we need to stay within. So men need to be somewhere between a 0 and a 4-degree forward anterior pelvic tilt. And women typically need to be somewhere between a 3, 4 to 7 range of a anterior pelvic tilt. Okay. And I'm probably like, looking at this, I'm probably like 10 degrees here. Okay. So I'm really steep. But if you watch people walking, especially from the side and that sort of thing out in public, you'll see this all the time. I see it every day. I get people coming to me all the time with back pain and things like that. And a lot of times it's just the pelvis is out and other things are out and it needs to be fixed. So people that are like this, their hamstrings are stretched out. They will commonly say their hamstrings are tight. That's only because they feel them all the time because they're hanging on their hamstrings. Their hamstrings are really not tight. And their hip flexors here in front are very short and tight. This comes from, sitting quite a bit. Their lower abdominal muscles are all stretched out and do not function. Their glute muscles are all stretched out and do not function. And those are the two big stabilizers of the pelvis, is these glutes and the lower abdominal muscles. So this makes people very unstable and out of balance, which is really bad for when we get older, because the number one cause of death when we get older is falling, losing your balance, falling, breaking a hip or something like that, ending up in the hospital and having to get surgery. And the surgery is, so traumatic on the body that people typically can't recover and they get sick and they pass away. So we need to make sure that we keep all of this into proper alignment. So that would, for this particular person, it would be stretching of the hip flexors, stretching of the low back muscles, tightening up of the glutes and even the hamstrings a little bit to help too, as well as stretching out the upper quad muscles or the rectus femoris, so that we put this back in balance. And then on top of that, retraining the position, which I will get to more at the end of this. Okay, so we call this more of a Donald Duck posture. And you see all the different changes here. I'm going to show some other people too. Let's make sure I didn't miss anything. So knees locked out, highly important. You can't create any power in this position. So what ends up happening is a lot of times the load, when you do try to create power, say if you try to run from this position or walk from this position or anything else, the load all goes through the lumbar spine here, the low back, and sometimes it can get stuck in the mid back area as well. So we got to watch out for that. So here's some more examples of anterior pelvic tilt. So if we start up here on the upper left, we've got this gentleman in here, and I thought this was really great because he's wearing suspenders on top of that. And so you can see how far away this suspender is on the backside of his body from his lumbar spine. So the suspender on the front is actually touching his stomach. And it's not because this guy's he's not, hugely overweight, right? I mean, it's the fact that his pelvis is totally dumped forward and shouldn't be there. His knees are all locked out. Even though he's wearing pants, I mean, those pants are perfectly straight down the back. His knees are locked out in there. So, and if you draw a line up from his ankle and come up here, once you get up through his hip, his whole body is ahead of that line through that ankle. Okay. Very important. I look at all of my clients from all angles at all times to make sure that we're holding a good posture, especially in our standing posture. We always want to start in a good posture and finish in a good posture. And that typically leads to moving through good postures as well. Then we move over here to the right, and this lady that's wearing heels. And wearing heels is the best way to create an anterior pelvic tilt and screw up your back and your neck and all sorts of things. I am constantly rehabbing females from this. So a 2-inch heel puts a 22-degree forward lean into the body that your pelvis and your spine have to counter against. So that also means if you go up to 4 inches, we're looking at 44 degrees. And if you go up to some crazy 6-inch thing, you're looking at a 66-degree angle forward. That would be like, something like this. That'd be like going up towards this other guy's chest in front of her that you have to fight against. Okay. So you can see with her, knees locked out, pelvis dumped forward. Typically, this goes along with this hyperlordosis of the lumbar spine, low abs pooched out. All of you ladies that don't want your low abs sticking out, you do not want an overemphasized anterior pelvic tilt. It's really bad. And then, you know, she's got hair covering up her ear, but you can basically do the same kind of thing. If you draw that line up from her ankle and go straight up, once you get past the top of her glutes, the only thing you're going into is the hair on her back, not touching her body anymore. So she's like totally, you know, too far back. Next over here, we got Mr. Policeman, and he's the same thing. He's even got his hands on his hips, exaggerating it even more. This is really bad because policemen, prison guards, you know, any people in the security field, they're typically wearing some kind of weighted belt, which is then emphasizing this load on the pelvis even more. So if this pelvis is not in the right position for someone that's wearing a weighted belt or a backpack or anything else like that, you're just, you know, multiplying the effects of the whole problem. So same thing, knees locked out, you know, tummy's going to pooch out. We got, if we go up from his ankle, same thing, we get up here to his hip. And then once we get to that, it's just kind of going up the back side of the body. So it should go, it should end up going through the shoulder and passing right through the middle of the ear. So then if we go down here to the bottom left, and we've got this lady down here. So the picture on the left-hand side of her, well, not of her, but the picture of her on the left here, that's her anterior pelvic tilt. You can see how it's tipped forward more, how her knees are locked out. She's got the bigger curve in the lumbar spine. The abdominals are coming out a little bit. And then the picture of her on the right is more of a neutral pelvis with her pelvis tucked under. So that we have a more of a normal curve in here. Our lumbar spine curve should be somewhere between 30 and 35 degrees. This is something else that I measure every time I start working with somebody, so that I know where these things are at, so that I know what muscles we need to strengthen and what cueing points I need to give people to fix these things and put them into the right spot so that their body can function correctly and take the load off of their knees and ankles and everything else. And then over here on the right, we have this gentleman, and we've got the lines right on here. So the picture on the right with this big diagonal line coming down, that is the severe anterior pelvic tilt. This is the severe Donald Duck posture. I mean, he looks like a duck. I mean, it's amazing that he can go this far. He must be like a yoga person, or this photo is altered. So knees locked out, tummy in the bottom pooched out, and that sort of thing. And if you draw the line from the ankle straight on up, once you get past his hip, we're in air, not touching any part of him. And then on this one, that line is already drawn in. You see this red line that goes right through his ankle? This is ideal posture. Where it comes up, it bisects the knee joint. It bisects the greater oh boy, I'm having tough times with the tongue today. The greater trochanter, which is where your femur inserts right into your hip joint or your ilium. And then it bisects the middle of the shoulder joint, so right over the humerus there. And then it goes right over the top of our ear, covering up the middle ear. All right, that's ideal posture. That's what you're looking for. Really hard to find this in people. Okay, you'll even see mine at the end. Mine is not perfect, so I don't ever claim to be perfect. There's always things to be working on. So that's anterior pelvic tilt. All right, we need to focus on finding out what we are. So now posterior pelvic tilt, or what we refer to as Pink Panther. And with Pink Panther, we are the opposite. Now we're dumping water out of the bucket. Okay, pelvis is tucked under completely. All right, this is commonly, I see this a lot in contractors, not quite as much as I used to, but more so back when contractors were using clipboards and not cell phones and everything else to do everything with. Because they put their clipboard on their hip and then stick their hip out and then write on their clipboard and things like that. And so hamstrings tight, calves are typically tight. The low back is typically actually stretched out. It probably feels tight on them, but it's actually flattened out. There's less of a curvature in here. The abdominal muscles are typically tight and short. The hip flexors are typically stretched out and weak and not nearly strong enough, which leads to all sorts of other problems. And so these people typically complain more of low back problems, basically just because there's no way to dissipate the load going down through their spine, because it's all stacked up on top of it itself. So we need to, straighten that out. So, and how we do that is by stretching out the hamstrings, tightening up the hip flexors, stretching out the abdominal muscles, and tightening up the low back muscles. So, and then of course, the corrective practice of trying to do all this the right way. With this, the weight will be extremely back in the heels. The knees will typically be fairly soft. And if we draw that line up through the ankle, you'll see that once you kind of get here to the hip joint, now the majority of the body is behind the line, and the line ends up going in front of the face. Okay. So this is what we refer to as our Pink Panther posture. And now some more examples of this. So if we start over here on the left with this lady here, she's got her pelvis all tucked underneath. Okay. And with that, we end up having, the glutes tucked down. It's like the tailbone's all tucked underneath. The hamstrings are super tight. And when we bring that line straight up, the line ends up going in front of her body because of that tip. Her spine is going backwards this way, and then her low back is pulled out this direction. Up here in the top middle, we actually have this gentleman again. This time we have it all three ways. We've got the anterior pelvic tilt here in the middle that we had on the last or 2 slides ago. And then over here we have the posterior pelvic tilt where he is tipped backwards. And you can see here, there's the line for his, through his ankle coming all the way up. It ended up going way in front of his face. And then we have his, the normal neutral again. Okay, that's where we want to be. And then over here on the right, we have this other person here, once again, posteriorly tucked under. And so hamstrings short, knees soft. And this person's actually got some other things going on because they've got some forward head posture going on too. So there's, all sorts of crazy things. But because of this, the low back stretched out, it's flat. Abs are tight. That's why their chest is actually down and their hips are actually up, because all of that's incredibly tight. All right. And so now we have a neutral posture, what we're all want to shoot for, because this allows us to generate power and force and go as fast as we possibly can, as well as cause the least amount of load on the human body. And I decided to put superheroes on here. So I put Superman and Wonder Woman on here because their alignment should be ideal. I could not find any lateral views of them. But because, once again, they are cartoon figures, they can just be drawn correctly, which is great. But as you can see here with me, if you draw that line through my ankle, my knees are soft the way they should be because my pelvis is in a neutral position. They were softer when I was in the posterior pelvic tilt, and they were locked out when I was in the anterior pelvic tilt. So now they're soft. If you draw that line through my ankle, it comes up through the knee joint, and then it comes up through my hip joint. And I've worked on this quite a bit over the years. So it comes up through the middle of my spine. It ends up coming up through the middle of my shoulder joint. But now, because of my vision impairment and a little bit of today's society of computers and cell phones and everything else, I have a bit of a forward head posture. So it does not go through my ear. It goes through just behind my ear, actually. Okay. Obviously, I wasn't paying enough attention when my wife took this picture of me. So, but this is kind of the way it is. But that's why I keep my neck so strong and I stretch it on a regular basis, because I know, because of my vision, that I'm putting a lot of extra load on my neck, and I need to keep it very flexible and functional so that it can handle the loads put on by my weaker vision. Let's see. So that's neutral spine. that's what we want to go for. Best way to do this is like stand up against a wall, and that wall should be touching you at your tailbone, in the middle of your upper back, and on the back of your head. If you can stand against a wall with, you know, your feet right underneath you, not sticking way out in front. I mean, they can be an inch or two away from the wall, but not like 6 inches away from the wall. And your tailbone's touching the wall, the middle of your back's touching the wall, and the back of your head is touching the wall. That's the way you should be all the time. Then you need to walk away from the wall and maintain that position. Most people feel very uncomfortable, but that's where you're actually in a neutral spine and pelvis. So now we have this lady who's obviously done some yoga, because she can actually move her pelvis, or belly dancing or something, because she can move her pelvis without moving too much of other things in her body. Which is why I wanted to show you this, that it's, you know, it's really important. It totally changes the way the loads are coming down through your body. So especially for those of us that run or walk a lot, it's incredibly important to be in a proper position. So we start here on the left. She's got her anterior pelvic tilt. And with that, you can see how her knees are a little bit straighter in this picture than they are in the other pictures, not by much, but a little bit. And you can see how there's more lordosis, or bigger curve, here in her lumbar spine. And you can see how her tummy's dropped out the front a little bit, once again, because she's got that anterior pelvic tilt. All right. And then everything above that, she's, you know, pretty much got straightened out, because she's obviously flexible. Most people aren't. So in this, once again, I'll repeat it. We would stretch hip flexors, low back, and we would strengthen lower abdominal muscles and hamstrings, okay, to try to start working on that, as well as practice, practice, practice. Then we go to the middle picture, posterior pelvic tilt, okay. I see the posterior pelvic tilt more in men than I do in women. It's pretty rare that I see it in women. So with this one, knees much softer, weight back in the heels instead of the ball of the feet in the last one. And so now you can see how flat her lumbar spine is comparatively to this one here on the left. So that lumbar spine is all stretched out, and it's stacked on top of itself. This is a person waiting for a disc herniation in bending and picking something up, because their back is already flat. And those discs will just shoot right through that ligamentous material if that ligamentous material is weak. So with this kind of person, we need to stretch the hamstrings here. We need to stretch out the abdomen there, and we need to strengthen the lumbar erectors here and get them a little shorter. And we need to strengthen the hip flexors, hip flexors here. Still having tongue problems. All right. And then neutral pelvis. You can see here, you see the line, it is not perfectly flat. Okay. It's got a little bit of a forward slope to it. Like I said, women should be somewhere between 4 and 7 degrees of a forward pelvic tilt, and men should be somewhere between 0 and 4 degrees of a anterior pelvic tilt. Okay, it's because we are designed to go forward that way, and so our pelvis needs to have a small little anterior pelvic tilt to it. So with this, weights back in the heels, knees are soft, nice normal 30 to 35 degree lumbar curve, a nice normal 30 to 35 degree thoracic curve on top of that, and a nice normal 30 to 35 degree of the cervical curve above that. Okay, all those things I measure when clients come and see me to know where they're at. The tummy is not sticking out the front like it was over here on the left. Everything's in a good position and all right over, so that all of the muscles are dissipating. It's not your spine that should be holding the load, it's your muscles. Your bones are hung in your muscles. It's kind of like a mast on a ship. When the wind blows into the sails and fills the sails, the ropes pull on everything, and everything goes tight. And that's what generates the best propulsion power into the ship, is having everything balanced and functioning correctly. And the same thing goes with the human body. Our bones are kind of more hung, even though they're connected to each other, they're still hung in our muscular structure and in our fascia and our connective tissue. And so it's the muscles that dissipate the loads when we're walking, running, jumping, skipping, even cycling and things like that, not the bones. If it's the bones, it's because something's out of alignment. All right. So that was all of them. So that's my little talk today on pelvic posture. Now you know the do's and don'ts. Try standing up against a wall. Try having someone taking a picture of you from the side so that you can get a better idea to see where you're at, and shoot me your questions if you have them, or if you want help from anything, you just let me know and I will help you out whenever I can. And I hope all of you have a wonderful, great day and have strong, healthy pelvis posture.